Let's turn now to assistant professor at Harvard School of Public Health, Joseph Allen. He's got a new piece in the Washington Post entitled, "Need Some Good News About COVID-19? Here are 6 reasons for optimism." Joseph, good morning. We could all use a little optimism right now. One of the areas where you see hope and you're optimistic is in masking, which seems to have caught on, as you write in the piece. There are some areas, like the governor of Georgia says he will not hand down those mandates or support mandates city by city. But for the most part, and I'll go back to that NBC Wall Street Journal poll, Americans are wearing masks. 74% of Americans in that poll say they now always wear a mask when they go out. That number is up just over a month ago. So where else do you see optimism?
Well, yeah. So good morning. Thanks. That's great that we finally turned the corner on masks. The public health community has been clear that there are benefits to mask wearing. We can actually control the spread pretty well if a vast majority of us wear masks. In other areas that are a bit under the radar, we see a lot of other signs of hope. And this is because when you have every scientist in the world focusing on the same problem at the same time, it's inevitable we'll have these advancements. So one that I think of is therapeutics will beat vaccines. We've already seen this with remdesivir, the antiviral, and dexamethasone, the steroid, which are for those in the late stage of the disease. But there are also something called monoclonal antibodies, which will be coming on the market this fall. Now, most people know your body develops a response to this virus, develops antibodies. These monoclonal antibodies are engineered antibodies, and they look like they're working. In fact, not just look like, they are working. We should expect to see these in the fall. Another area that's really important, has been an advancement, is in testing. A colleague of mine, Michael Mina at the Harvard School of Public Health, wrote about this in the New York Times, rapid saliva-based testing. So imagine a home pregnancy test, but for COVID-19. So in this case, a saliva test, strip of paper goes in your mouth, really cheap, rapid response, and that can really free up the economy a bit because it'll give people confidence. You want to go into a store, a school, go to a theater, just take that rapid test. Here's something that's counterintuitive about this, is that it doesn't even have to be a perfect test. If it's cheap and the answer comes back quickly, even if it's inaccurate because you can take it every day, it can significantly slow the spread across the population. There's some other positive signs too. I think of new research, several pieces of research that are showing that for some reason, 20 to 50% of people who have never been exposed to this virus still have immune cells that react to this virus. Now, the speculation is that this is because of past exposure to other common cold coronaviruses. There appears to be some cross-reactivity. What this means and how much benefit that provides is still unknown. But there are signs happening just under the headlines and front page news that scientific breakthroughs are happening.
Yeah. And Joseph, you point out there in your last one, vaccine trials seem to be working. We got some good news early this week. Obviously, it's early in the process, but some of the vaccine trials do show effectiveness in some of those patients. How soon are you looking at a vaccine, and how revolutionary will it be to what we're witnessing every day to actually have the vaccine out there? Because it's one thing to have it, it's quite another to produce enough to get through the country and to distribute it quickly.
Yeah, that's right. You know, there's great news on vaccines this week. And I just want to remind people, just a couple months ago, we were not even sure we could have a vaccine for this coronavirus. And in the history of vaccine development, it has taken years to develop a vaccine. This will be the fastest by far, and the signs are all positive. But you point out an important caveat. While the vaccine will be ready, we hope, by the end of this year, as my colleague Juliet Kayyem from Harvard Kennedy School points out, vaccines don't save lives, vaccinations do. The hard part of the vaccine process is going to be the manufacture and distribution. We should be working on that right now. But I'm more confident in the therapeutics in terms of beating it. Vaccine is the end game.
All right, Joseph Allen of the Harvard School of Public Health with some reasons to be optimistic this morning. We could use them. Joseph, thanks so much. Good to see you. That does it for us this morning. We will be right back here tomorrow on Morning Joe. For now, Stephanie Ruhle picks up our coverage after a short break.
Thanks for checking out MSNBC on YouTube, and make sure you subscribe to stay up to date on the day's biggest stories. And you can click on any of the videos around us to watch more from Morning Joe and MSNBC. Thanks so much for watching.